I would like you to do a think, pair, share. So turn to the person next to you and introduce yourself. Share one fact you know about health, one question you have about health, and one reason why learning about health is important to you. So, are there any pairs that would like to share what they had talked about?
One thing we talked about that we all definitely agreed about was one question you have about health is how do we integrate health treatments for people who don't necessarily want Western medicine approaches? So that was one question we have is how can we integrate if somebody, I do have a client I have a few clients from different parts of the world, as I'm sure several other people do here, and they don't want to take the Western approach to medicine, and they want a specific kind of doctor and a specific kind of treatment. So that's kind of one thing we talked about that we all agreed about is how can we integrate that for people so they can take care of their health. Thank you.
We talked about, one of the things we talked about was how COVID has affected our engagement with people. It's been very difficult. I said prior to COVID, I personally didn't have a problem, and I know so many people. I work for United Healthcare, and going out and doing face-to-face visits, it was much easier. And now everybody's just so closed off still, and it's really hard to get them to want us to come out and help, and everybody just is like, no, I'm good. I don't need anything. And getting them re-engaged with us, but with their doctors as well. So I think that I see a lot of heads nodding. So I think that's something we are all experiencing as people who work in the community. So if anybody has any great ideas, come see me.
Hi, I'm Vicki. So we do a little bit different. So we both work in high schools, and I'm a drug and alcohol counselor. And so one of the things that we have come up often is kids asking, like, can I take melatonin? Can I self-medicate? Marijuana is a big thing. And so those are questions like that we get a lot. And so I always try to refer them to talk to their physician, have their parents talk to a physician, but they still keep wanting to come back like, well, I can take, and I'm like, well, this is what the bottle says, but you really should be talking to your physician. A lot of our kids also have mental health diagnoses, so they're on medications for that. So it's just getting them to accept the fact that we can't give them answers, but if they just go to a physician and talk to the physician to get the support is a big one for us.